had a comment. I'm starting to try to go through my comments more. I'm really trying hard to be better about it. It's just a lot to keep up with social media, Facebook, Instagram, LinkedIn, YouTube. It's a lot. I wish it was all in like one spot, but at least the YouTube comments are in one spot. I found another area where I could just go and easily answer your questions. And this is a really good question and something I see a lot. Somebody that has chest pain and they think they have costochondritis, okay? So you're going in with chest pain and then you also have anxiety with that, okay? So somebody asked me if taking anxiety medication causes costochondritis. No, not typically. Now, oftentimes what we see is the opposite, right? So we see people that have costochondritis, chest pain, and when they take a breath in, it's that sharp stabbing pain. Sometimes it's on the left side, where your heart is. So you're thinking you're having a heart attack. So that just creates all sorts of anxiety, panic attacks, right? And I've done videos on panic attacks, heart palpitations. I recommend that you watch. I've done many videos on that. I recommend that you watch that too, and maybe you can make this connection I'm about to go into. So you have chest pain, and then maybe you think you have costochondritis, which is amazing because costochondritis is really hard to get diagnosed because there's no test for it. It's so frustrating, right? No test. But the one test, I just did a video yesterday on the one test, if you think you have costochondritis, and the one test that they never, ever do is an x-ray of your spine. They do it of your chest, no good. You want it of your spine because the ribs attached to the spine of the back. But that's not what this video is about. This video is about taking anti-anxiety medications. Does it cause costochondritis? No. But it can be the other way around, that it makes you go on anxiety medication, that you never had that anxiety before you had costochondritis. So the anxiety came later. Now, everybody has a little bit of anxiety, right? You're about to go up and speak in front of a lot of people or whatever it may be. We all have some level of anxiety. It's natural, but this is a different kind of anxiety. And you guys out there suffering know exactly what I'm talking about. I've seen people in tears in my office. So, it's a joy for me to see them smiling and laughing afterwards, later, weeks later, months later, in some cases, in severe cases. But what I want to tell you is this may not be costochondritis. Whoa, that's a mind. I won't say the word because this is PG rated, but my channel's PG rated at least. There are many that are not, but you may not have costochondritis. You may have a hiatal hernia. If you have bloating after you eat, difficulty getting a full breath in, especially you're climbing stairs, you get winded easy, feeling full right after you take a few bites, LPR, chronic nasal mucus clearing your throat, nasal post-nasal drip, pit in your throat, GERD, acid reflux, of course, heart palpitations, panic attacks, and anxiety. And again, if you watch those heart palpitation videos, the vagus nerve videos that I've done, you will make that connection here. You may be misdiagnosed because a hiatal hernia can also cause chest pain. Yep, even up here, because your esophagus goes all the way up. So, yeah, it can cause heartburn, but it doesn't have to be heartburn. Some people get LPR silent reflux, no heartburn at all, right? That's more the mucus, chronic nasal drip, the cough at night, usually when you lay down, tickle in your throat even, gets worse sometimes when you lay down again, right? So I hope that helps you guys. Just get the right diagnosis and the right help. So if you think you have costochondritis, but now you're thinking, whoa, I have all those symptoms you just mentioned, I think maybe I have possibly a hiatal hernia. Maybe I don't even have costochondritis. And some people have both, and I see both. These are two conditions I specialize in, so I see both. So that's really some food for thought there. I hope this video helps you guys. And comment, chime in below. If you do have a hiatal hernia, we're about to start a membership for hiatal hernia sufferers. Everything you need to know, from tips to how to rehab it, to the gastroesophageal junction, understanding everything in a simple way. I'm going to do that for you. So check out our membership that's starting here soon in a couple days. And then also check out our videos, subscribe. We've got 4 new videos. Check out our playlist for costochondritis. And if you have a hiatal hernia, or you think you do, check out that one too. So we've got 2 different playlists there and many more playlists. Thank you again for your support, your love. I read all those comments, or most of them, so thank you. And for the haters, thank you. Love you. God bless you. Thanks for tubing in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.